Welcome to the PCN Capitol Preview. I'm Larry Casper. Governor Shapiro's state budget proposal and its impact on labor is our topic today. You can join our discussion by calling us at 1-877-PA6-5001, or you can text us at 717-219-4001. But first, we're joined by Carter Walker from VoteBeat. Welcome to our program, Carter.
Hi, thanks for having me.
The ACLU is suing Butler County over a mail-in voting dispute. What's the case they're making?
Yeah, so the ACLU is suing Butler because Butler County elected not to accept two provisional ballots from voters who had errors with their mail-in ballots. Now, provisional ballot, you probably know, is something you use at your polling place when the election officials there can't immediately verify that you're eligible to vote, but you still want to cast a ballot. And then after the election, the County Board of Elections determine whether or not you're eligible. The two voters in Butler had gone to their polling place to use a provisional ballot because the county had rejected their mail-in ballots because they hadn't returned their mail-in ballots inside of the secrecy envelope. So that's, what we call a naked ballot. So they had their mail ballot canceled, and then they went to the polling place to vote provisional, but that provisional ballot wasn't accepted. So the ACLU is suing on their behalf.
Carter, why was that provisional ballot not accepted?
The county, there is a case from the State Commonwealth Court from 2020, which was non-precedential, is my understanding, but it said that the way it has been interpreted by some counties to say that provisional ballots cast under those circumstances, when you have a canceled mail ballot, can't be counted. And obviously, the idea is preventing somebody from voting twice. But again, the mail ballots in this case, and there was a similar case in Delaware County last year, the mail ballots in those cases were both canceled, so they weren't counted in any event.
Carter, can you tell us approximately how many mail-in ballots were rejected statewide because they were filled out improperly, or as in the case of the Butler County voters, they had neglected to use the secrecy envelope?
Yeah, I believe the total is just around 16,000.
Mm-hmm. And talk about what other Carter, what other flaws then have commonly been noted along the way with mail-in ballots? Neglecting to use the secrecy envelope, and there's also controversy about signature and date too, right?
Right, yeah. So voters who don't sign their return envelope, who don't date it, under current case law, that one is always in flux, the dating. If you do not put your envelope in a secrecy envelope before putting it in your return envelope, that'll get canceled as well. And that accounted for like 16,000 ballots this past election. But it will likely be more come November, given the higher turnout.
Well, Carter, how common is the practice of counties notifying voters so they can fix their mail-in ballots?
Well, that is the million-dollar question right now, at least, and what made me interested in the Butler County case, because I had seen that the ACLU was putting out records requests to a lot of counties, asking them about their policies, and this is a process known as notice and cure. You notify the voter that there's an error, and you give them an opportunity to fix it. I know of at least 17 counties that are doing some version of this, but it varies greatly. Some counties will cancel your erroneous ballot and issue you a new one. Some of them give you a call and tell you to come into the office and put the date down on the envelope. So the practices are a little bit all over the place right now, which is why it seems like it's an area that's ripe for litigation.
Well, since the practices do seem to be all over the map, Carter, as you say, have some methods for repairing mail-in ballots been more successful than others?
Yeah, Allegheny has a method where they will mail back the erroneous ballot with a letter saying, hey, you didn't fill in the date or you didn't sign it. Here's a new return envelope. Please do those things and send it back to us. That was able to correct about 62% of ballots in this past election. Some of the data I've seen from counties that say, hey, come in and please fill out the error, I've seen that that's successful for about 40 to 50% of ballots. So yeah, the method does vary on how successful it is, but still seems like allowing curing in some kind of form is successful in fixing a lot of ballots.
When is there likely to be action on behalf of the 2 voters in Butler County?
Well, most recently, if I'm recalling correctly, there was a hearing, and where the 2 sides, made their arguments. So I think we're still waiting on a ruling from that. Unclear when that will be, but we're keeping our eye out for other litigation that might come on this subject. You might have seen before the election, the ACLU and the Public Interest Legal Center, which is a partner to them on these cases, sent wouldn't call it the demand letter, but a letter to Washington County warning them of their curing policy going against the law. So I'm looking to see if more litigation will get filed there.
Last question, Carter. What has to happen in order to put a consistent statewide policy in effect for fixing mail-in ballots?
Yeah, well, across the board, everybody you talk to in the election administration space will unequivocally say that the legislature needs to act to shore up some of the inconsistencies and things that were just not thought of when Act 77 was written. That would obviously be the thing that could happen immediately that would provide a statewide uniform system.
All right. Thank you, Carter Walker from VoteBeat.
Thank you.
Welcome back. Our guests are Aaron Chapin, president of the PA State Education Association, and Silas Russell, executive vice president of SEIU Healthcare, Pennsylvania. Thank you very much. Silas, let's go back to the governor's original budget proposal and tell me what your general impressions are.
Hey, good morning. Thanks for being here. And just to introduce myself, SEIU Healthcare Pennsylvania, we unite tens of thousands of caregivers across Pennsylvania who work in all care settings. And I'll just first say that, our reaction to the governor's budget proposal is there's a lot of really promising starts to continue to move our state in a positive direction, investing in workers, investing in our public education system, and especially strongly support the governor's renewed call for a $15 an hour minimum wage to go there immediately, something that has been lagging for years and years and years that workers have been demanding. And I'll say that we still have a lot more work to do beyond what the governor has proposed, especially investing in frontline caregivers like home care workers and nursing home workers, getting resources to those front lines to ensure that caregiver wages that in home care average about $13 an hour with no benefits can finally be lifted up to a place where we can put caregivers in people's homes, provide services for people with disabilities and seniors who need them and are asking for them, and ensure that those workers have dignity and training and respect in the care that they provide. So we think it's a strong starting point, but there's a lot more work to be done by the legislature and by stakeholders to get us to a place where we continue to lift up all workers across Pennsylvania.
Aaron, what stands out to you as being noteworthy about the governor's budget proposal? Well,
we think the governor at PSEA, we think he has really has an aggressive budget proposal that's going to take care of our schools across the Commonwealth. It's obvious that he respects what needs to happen for our students. And there are some great investments when it comes to student mental health, as far as building infrastructure and basic education. It's clear that he has taken the Basic Education Funding Commission's recommendations that came out this winter. He's taken them very seriously and implemented them into his proposal. So we can't wait for this to become a reality.
Aaron, we'll get into the commission's report shortly, but let's consider just the basic figure that the governor's proposing for basic education. $1.1 billion. How does that figure strike you?
That's going to be a great investment. Of course, over the past administration and into Governor Shapiro's first term, his first year in office, he has continued to push the funding for our schools, and $1.1 billion is going to really start to help level the playing field for all of our schools across the Commonwealth that have been historically underfunded for generations, and this is the first step in making things right.
And Silas, what do you think of that $1.1 billion proposal from the governor?
Yeah, we're obviously incredibly supportive of it. We think it's an absolute essential commitment to get us to that overall, close that overall gap that has been identified by the Basic Education Commission, and a really big step forward. We expect that should get done. We call for that to get done by the legislature, and then to continue to move forward to ensure that we have an education system that's fully funded for every student across Pennsylvania.
Aaron, you said in a press release that the governor's budget proposal for education is the first step in a multi-year process. So what else has to happen?
This is based on the Basic Education Funding Commission's report. They outlined that this needs to take place over a 9-year span. This can't be something that, or a 7-year span, excuse me. This just can't be something that is done overnight. While it needs to be aggressive, we obviously need to implement it over a number of years. So this is just the first step. And as we go through the next few years of budgets, we need to keep investing because again, it's been generations of neglect when it comes to funding. It's unconstitutional, as the Commonwealth Court decided, and it needs to be a consistent investment so that we get our students to places where they're going to be much better off.
Why will it take 7 years to put this process in place? Some people, of course, get impatient, so let's tell them.
Well, it's $9 billion that it's going to take to get our schools in a much better place. And obviously, we don't want to be taking all of this money and investing at once, but we need to be doing it gradually. We need to be responsible about this so that it's not going to have an impact on Pennsylvania's economy.
Silas, have you been paying attention to the report that Aaron just mentioned by the Education Commission and their recommendations?
I'm sure I'm not as well versed in it as Aaron is in that report, but we as SEIU broadly strongly support a fully funded public education system that invests in the workers, that provide the services and the education in our schools, and ensures that every student has access to a great public education, no matter where they live, where they come from, what zip code they live in. And so, those are our members, whether they work in public education or they work in healthcare. They have families that rely on that system, rely on the teachers, the educators, and the support staff that provide the best possible education that they're able to provide. And we need to make sure that they have the resources that they need to ensure that our students are well educated.
Aaron, Silas brought up teachers, so let's consider about how much are they earning now every year. Give us a status report.
Well, it's not enough. Our average salary in Pennsylvania is far below our surrounding states. You go to Maryland, $60,000. West Virginia is $50,000 minimum salary. You go all around, every state around us, teachers are making more. In Pennsylvania, it's just not enough. And
about how much is it in Pennsylvania?
It's in the $40,000 range, and so it needs to change. If we want to have the best for our students, we need to attract the best and the brightest. And the fact of the matter is we just don't have a lot of younger people going into education. Those that are getting their degrees, they are leaving the state. We have a 66% drop in first-year certificates in education. It's gone down significantly. We've got 2,000 vacancies right now in this state and that just can't happen for our kids. We need to invest in them, and that starts with our teacher salaries, but also our support staff salaries as well. They need to be paid a living wage, and it's just not happening here in Pennsylvania. We need to invest in our workers in our schools.
So if you had to put a figure on it, put a price on a teacher's income, Aaron, what would it be approximately? In order to be competitive with surrounding states, like you say.
Yeah, if we're going to be competitive and attract the best and the brightest of Pennsylvania, it needs to be $60,000 a year for teachers. Our support staff, they should be making a living wage of $20 or more. We need to invest in them, and our kids deserve it.
We have a text question that just came in, Silas. I'm going to direct it to you. The question reads, how can we fight to secure good jobs for home care workers?
Yeah, that's a great question. I mentioned home care in my opening remarks. Much as Aaron's talking about educators and support staff in our public education system, home care workers are the absolute essential workers in our long-term care system. Right now in Pennsylvania, the average wage of a home care worker is about $13 an hour. They get no time off, no health care benefits in many home care settings, and it's absolutely unconscionable that we expect workers to take a vow of poverty in order to care for the people who are our most vulnerable citizens. And there's a reason why. I mean, that's the reason why there's only one caregiver in Pennsylvania for every six Pennsylvanians who actually require in-home care. So how do we do it? We got to put resources into the system, and we got to ensure through accountability that those dollars get to providing care and are not siphoned off by private agency profit taking. And there's some really strong proposals by the legislature to do just that. And we also believe that the budget can make those investments right now to lift those wages to workers. As Aaron said, support staff in our schools should get to $20 an hour. We should have every home care worker in Pennsylvania on a path to $20 an hour. And there's no reason we can't do that.
Viewers, if you want to send a text message to us, the number is 717-219-4001, or you can still call us, 1-877-PA6-5001. Aaron, let's return briefly to the Education Funding Commission report, which we've already mentioned a few times. And in our minds, let's go to the last page of that report and consider what the recommendations are.
Their recommendations, again, they're proposing, they're suggesting to the legislature. And again, this is not something that, it's merely just a suggestion. It's something that the Commonwealth Court says, you need to fix this. It's been, unconstitutional. And so they're recommending that it's, around $7 billion. I'm sorry, it's around $9 billion over the next 7 years. But they're also saying, we need to make investments into special education. We need to make investments into our building infrastructure. If you go across the Commonwealth, we have so many buildings that are old, they're failing, they're too hot in the beginning and end of the school year. They're cold during the winter months. The HVAC systems need to be replaced, the technology. So there's a lot of upgrades that need to be made to our buildings. And they recognize that we just don't have enough staff. There need to be more nurses. There need to be more support staff in all areas. There need to be, we need more guidance counselors and school psychologists, in addition to just having classroom teachers. So they've made it very clear that there are many areas that the administration as well as the legislators need to be focusing on. There are just a myriad of different investments that need to be made.
Silas, let's get back to the home care workers you were talking about just a minute ago. And just who are the home care workers you represent? Give us some insight as to what they do.
Yeah, I mean, home care is been for the last couple of decades one of the fastest growing professions in America, because we have an aging population and people want to age in their home. And home care workers really are the invisible heroes in our healthcare system. They're the people who provide direct in-home care and support to seniors and people with disabilities across the Commonwealth. They're in every single neighborhood, every single community, largely women, largely people who frankly do it out of love for the people they care for and out of respect for the people in their community. And so, because they've largely been invisible in the past, we have really neglected to invest in the support, the resources to get those workers to a place where they're being rewarded appropriately to take on that profession. And so, as I mentioned, many home care workers work for private agencies. Most home care workers in Pennsylvania work for private agencies. Some work on the side of care called participant direction, where they're hired directly by the person that they care for, and then paid through a voucher system from through the state's Medicaid program. And in both cases, those dollars that fund that system come from taxpayer Medicaid dollars. And so Pennsylvania taxpayers pay for those services. They pay for ensuring that our most vulnerable receive quality care. And right now, we're not getting what taxpayers should expect in terms of quality because we don't have enough caregivers able to do that work, willing to do that work at $13 an hour across the state with no benefits. And so, we really need to, we're going to talk a lot about workers today. We're talking about education workers, we're talking about home care and healthcare workers. In all these cases, these are public services that are invested by taxpayer dollars. And we got to make sure that those dollars are accountable when they're being paid out by private agencies. And we got to make sure that taxpayers are investing in a participant-directed side of home care in a way that ensures that workers have training, have proper pay, and have benefits that keeps people at the bedside and in people's homes.
Silas, on at least 2 occasions, you said home care workers are invisible. Why do you suppose that is?
Well, I think that part is because who they care for and who they are historically. As I mentioned, 85% of home care workers are women, 46% in Pennsylvania are people of color, and they care for largely people on Medicaid, our lowest income, poorest citizens. And sadly, in our society and historically, we really just failed to lift those people up in our economy and our society. I think that's changing. I think that's changing rapidly. Largely, it's changing because caregivers are standing together. They're joining together in unions like ours. They're allying with the people that they care for, disability advocates, the disability community, our seniors, and they're going into the Capitol. They're telling their stories. Senator Casey has been an incredible vocal advocate on the federal level to invest in home care, as has President Biden. Senator Casey has often helped tell their stories to help change that, and we got to continue to change that. And as we do, we have to recognize that every single worker, regardless of what they do or where they come from, deserves dignity and a living wage. And we're not going to have workers to deliver these essential services as our population ages to do that. And we're going to see people go without the proper care that they need. And so I think there's a moral reason to invest in home care workers, and there's a practical, pragmatic reason to invest in home care workers.
Silas,
the truth is,
go ahead.
I just want to say one real quick thing is that people, as they age and people with disabilities, they do not want to go into an institution to receive care. They want to stay in their homes. They want to live with as much dignity, as respect as everybody else in our society. They want to be part of their community. And when they are able to choose home care, it actually saves taxpayers money because it's much more affordable, even when we do properly pay home care workers and properly provide them with the training and the benefits that they deserve. And so it is a strongly pragmatic reason why we need to ensure that people have the ability to choose home care when they want it.
Silas, you said some home care workers are earning $13 an hour. So tell us, what's in the governor's new budget proposal that could change that?
Yeah, so the governor proposed a major increase to the Office of Developmental Programs, which provides in-home supports and services for largely the developmentally disability community. And so that's one really big portion of home care. And that investment that he has called for is also overdue and really important. And what it did not invest in is the Office of Long-Term Living, which provides the supports and services for through Medicaid our elderly population, our over 65 population, as well as people with physical disabilities. And we need to actually do a lot of work here to finish the job on the budget proposal to do that same level of investment to get accountable dollars into our home care system on the long-term living side. So we think that the governor is, he's talked about in his budget proposal supports and services for people in home, but his proposal does not go across the entire system, and we need to continue to make that change to get there entirely.
Aaron, let's go back to considering education in the governor's budget proposal. And what is in his current proposal that would affect student teachers?
Well, we're super thankful comes back in at the end of 2023. Student teacher stipend was put into place where student teachers during their 12-week placement, they would be eligible for $10,000 as a stipend. We're hoping that because we have so many student teachers in our state, we're hoping, even though the governor's proposed an additional $5 million for this, we're hoping we can get it up to $75 million. I know it seems like a large amount of money, but we've got 4,000 student teachers that'll be going through the system next year. And for all of them to have that opportunity, we need more money budgeted. So that's going to be a really great initiative that will benefit not just our student teachers, but it's going to benefit all of our schools. It's a great investment into the pipeline that has been so desperately needing teachers to be part of it.
And about how many applications have rolled in for this state-funded stipend for student teachers? After all, the pot of money is finite, of course.
Yeah. When it went live about a month ago, as soon as it went live, within the first 45 minutes, there were 1,000 of our college students that had applied for this money. And we're hoping, again, by the end of the day, we had 4,000 of our student teachers already log in and use up the funds. So it's obvious that there is a great need for this.
Sounds like the funds were exhausted on day one?
Within the first 45 minutes.
Wow.
750. It's only good enough for 750 of our student teachers.
Now, going back to the governor's original proposal for education, which is $1.1 billion, is that going to help fund this program next time? And maybe you'll be able to satisfy more student teachers?
Unfortunately, 1.1, as great as $1.1 billion is, considering all the needs that our schools have, this portion of the student teacher stipend program, it's just not enough. We need additional money to go into this. We know that legislators on both sides of the aisle see this as very important, along with the governor. So it's just we need, as we go through the next month, we need to find places to put this money.
So no increase then is being proposed, at least during this current budget cycle, for the student teachers now.
The governor proposed an extra $5 million, which again we greatly appreciate. But based upon when the system was opened up for these applications, it was just exhausted very quickly. So if we're really going to make this investment in our education system, we need an additional set of money to do that.
Aaron, how often do student teachers go on to full-time employment as teachers?
Well, unfortunately, there's not evidence to give an exact number. We've heard a lot of anecdotal stories of student teachers, of college kids saying, I just can't complete my student teaching placement because I can't go 12 weeks without paying my rent, buying groceries. Colleges and universities tell our student teachers, you're not allowed to have a job during this 12-week placement. And so it makes it really hard for them to pay the bills. They're oftentimes living away from home. They have to pay groceries and for electricity, much like some of our retirees have to make these decisions. Our student teachers are having to make these very difficult life-altering changes. And there are a number of college students who just say, I'm not going to complete my degree. It's just too expensive.
Aaron, now talk more about the support staff. In other words, the teachers, of course, are the tip of the iceberg. We can all see that. But there's other staff, too. And how are they doing? And who are they? And is there being more funding proposed?
Well, as Silas was talking about his healthcare workers and the lack of respect, I feel like, and I hear it from our support staff across the state, there's definitely a feeling of a lack of support based upon the salaries that many of them are being given, very similar to how...
Who is the support staff and what are their jobs?
Absolutely.
Just briefly.
No, absolutely. Our students see the support staff from the moment they get on the school buses in the morning until they go home. They're in the cafeterias, they're in the offices, they're in our classrooms, and they're taking care of the buildings and grounds, and that's just to name a few areas. Our support staff are everywhere in our school system, and our kids interact with them on an hourly basis. And it's so important to give them the resources because they are feeling a lot of frustration with the low pay and the low benefits. And then oftentimes our support staff, they've determined that it's just not worth it. As much as they love being with our students, but they can go to Sheetz, they can go to Wawa, they can go to Walmart and make $20, more than $20, doing something that doesn't have nearly the impact that being in a school building or and being in our school systems has. And so they're leaving out of frustration.
Aaron, Chapin and Silas Russell, I'm going to give you a break just for a minute while we look at program notes for PCN. On the issues has Pete Shelley from Pennsylvanians Against Gaming Expansion on the subject of regulating skill game machines. He'll be here on Wednesday at 8 p.m. He'll be followed by Representative Lindsay Powell, who will tell us about her bill that addresses remote stalking. She's at 8:30 p.m. Journalist Roundtable on Thursday has Ian Carble from the PA Capitol Star, Justin Schweitzer from City and State Pennsylvania, and Lindsay Weber from The Morning Call. They'll be here Thursday at 7 p.m. Join PCN for the 2024 PIAA Track and Field Championships. Watch live on cable or stream with PCN Select this Friday and Saturday starting at 8:55 a.m. For more information, visit PCNTV.com. The public affairs coverage you watch on PCN TV is now free on the internet. Go to PCNTV.com and check out our streaming service, PCN Select. PCN is a 501c3 nonprofit television network that receives no government funding. We rely on viewers and donors like you to help PCN bring you everything Pennsylvania. To make a donation, visit PCNTV.com. Silas, let's go to you. We were talking about the home care workers and your desire for them to make more money. And so I'm sure the governor's proposal to raise the minimum wage is of interest to you. Go ahead, Silas. Silas, we're having difficulty hearing you. So we'll try to get that fixed.
Looks like I got muted there.
Okay. All right. Start.
I apologize about that.
That's all right, Silas. You start over then. Tell us about your hopes for raising the minimum wage in the governor's budget proposal.
Yeah, I mean, workers across Pennsylvania and our union and others have been calling for an increase in the minimum wage to at least $15 an hour for a decade now. And look, I think that everybody would agree that 15 is a starting point, frankly. Really, workers in our essential services on the front lines really need to be making $20 an hour to live with dignity and without being dependent on public services in our economy right now. And so we should immediately raise the wage to $15 an hour, as the governor's called for repeatedly. And there's bills to do that sitting in committee. But the truth is, we also don't have to wait on those bills to lift many of the workers' wages that we're talking about here. As Aaron said, in public education, we can put those investments in. And on the healthcare side, and home care and long-term care, state Medicaid dollars go directly to pay those workers. And if we put the proper investments in on the participant-directed side of home care, every single dollar that raises the rate to in participant-directed home care goes directly to pay those caregivers. So there's absolutely no reason that we have to live with workers making $13 an hour with no benefits in Pennsylvania. The legislature and the governor need to work together to put those proper investments in, to listen to those calls from the caregivers and the people they care for, and lift that reimbursement rate. And on the agency side of home care, it's a little bit more challenging because those employers decide how to spend that reimbursement. And right now, a lot of private sector home care agencies that are owned by big multi-billion-dollar private equity firms spend about 65 cents on the dollar of their reimbursement rate and actually providing people care. And we need to put into the budget not only increases to our home care investment, but accountability on those private sector for-profit agencies to ensure that more of our dollars, at least 80% of our taxpayer dollars that go to home care, actually go to providing care by paying workers pay and benefits. And that's how we lift those wages up. And whether or not the opposition in the legislature continues to stonewall on minimum wage through the state budget, we don't have to wait on a minimum wage increase. We can lift thousands and thousands of workers' wages right now.
Silas, the minimum wage is currently $7.25 an hour. There's been no change since 2009. What do you suppose has held this issue back?
I think the reality what's held the issue back is very powerful corporate interests that lobby the legislature and hold these things up. And recently, Democrats took control of the House, and in that very first year after Democrats took a very narrow House majority, we saw a bipartisan minimum wage bill pass the House. We don't think that bill actually goes far enough. It doesn't go to 15 immediately, and we are far behind our neighboring states. All of our neighboring states have already raised the minimum wage. I mean, if you're living in a community that neighbors New Jersey or New York or Ohio or West Virginia, Maryland, I mean, would you expect to be able to find workers to perform jobs they're paying near the minimum wage here when people can go across the border and do that same work for more? But at the end of the day, powerful corporate lobbyists that want to continue to suppress workers' wages and abuse their market power hold up dignity and hold up fairness for workers, and workers aren't going to take it anymore. Workers are standing together, they're demanding change, and they're going to hold their elected officials accountable.
Aaron, is raising the minimum wage a concern for any of the people you represent?
I think our support staff would be ecstatic if the minimum wage was raised, because that will put a spotlight on the jobs that they are doing. It will help them as well. So it's absolutely something that needs to be done. It's mind-baffling why this hasn't been done in so long, when surely, especially a spotlight was put on all of these essential staff during the pandemic, just how vital they are. They were vital before the pandemic and after, but everybody took notice, and yet we still don't pay them the money that they deserve and give them the respect that they deserve.
Now, Senator Christine Tartaglione has her own proposal for raising minimum wage. She'd like to raise it to $20 an hour. Can lawmakers support raising it that much, Silas? Because after all, that's almost triple the current rate.
Look, I think the reality is that that is what it takes to live in Pennsylvania. Mm-hmm. And when we allow the private sector to pay workers a poverty level wage, what we're doing is we're subsidizing those jobs. Senator Tartaglione's $20 an hour bill, which we strongly support, and we applaud her leadership on that, is really around the rate of what independent economists have said it takes to be able to live without public assistance in Pennsylvania. And so why should taxpayers foot the bill if Walmart or a private sector home care agency, that is owned by a multi-billion-dollar venture capital firm, where their CEO is making millions of dollars a year, are wanting to pay workers and keep them in living in poverty, and then taxpayers have to foot the bill for food stamps and donations and keeping those workers, figuring out how to get those workers health care benefits. That shouldn't be. And so I think that the reality is that, Senator Tartaglione is being honest with where our economy is and where workers need to be.
And in the last couple of years, we've heard several proposals about raising the minimum wage, and it's a wide range that goes from $15 to $20 an hour. And part of the point of my bringing up Senator Tartaglione's plan is that it is yet another number for people to consider. And I'm wondering if negotiating a number here is critical to making this issue come together and get voted on in our legislature. Aaron, you have an opinion on that?
I think the fact of the matter is we need to keep talking about this, and it's an investment. Raising the minimum wage, raising the giving our employees a living wage, it's investing in your communities. And when I look across the state at where our support staff work, more often they're the ones that are living in these communities where these schools are. And if you invest in our support staff, you invest in our educators, it's an investment into that community. So these are dollars that are going to go right back into the community. So it's a win-win for everybody that lives across the Commonwealth.
Silas, what do you think? If there was consensus on what to raise minimum wage to today, would that lubricate the issue and make it move faster?
Well, I think that there has been consensus for years and years and years amongst workers, amongst advocates, and
I mean the legislature. I'm talking about the range within the legislature.
Yeah, well, I think that what it will take to get there is the legislators leaning in and being willing to say enough is enough. We're going to move something forward, and an open and honest conversation about that. And right now we haven't seen that yet, and we continue to push and demand that happen. And also workers aren't going to wait. If the legislature is not willing to engage in that conversation, then we're gonna demand that from employers. We're gonna demand that from whether the employer is the state when they or being paid by the state, or the employer is the private sector. Workers are gonna get out and demand that those investments be made.
Aaron, earlier you indicated a need to do repairs on school buildings. So I'm wondering, statewide, can you go into the specifics of what students are dealing with in school buildings, and it's making it difficult for them to learn?
Again, our buildings, they need to be in good condition, because that provides our students with the environment that's going to foster successful learning. But we have overcrowded classrooms across the Commonwealth. Doesn't matter if you're in a rural area or an urban area or in suburbs. We've got overcrowded classrooms. We've got students actually in some school districts where they're actually being instructed in closets. Because they've run out of classroom space. So, and again, I mentioned, many do not have air conditioning, and when the kids go to school in September and they're during these months in May and June, they become incredibly warm, but they're also too cold in the winter, and we need to fix these. Again, good learning conditions means good environmental conditions means we're going to have good learning situations. And that's really what we need to be doing for our students, is investing in the facilities across the state.
Aaron, here's another education issue that has flared up in recent weeks. And last time, the budget cycle, it came up at the last minute. I'm talking about vouchers for private and religious schools. That flared up at the last minute, last budget cycle. But here we are talking about it 2 months left. And what is your position on that?
We're a definite no when it comes to scholarships, vouchers, whatever you'd like to call them. It's an absolute no for us. You cannot take money off the top that should be invested into our schools across the Commonwealth. School districts that are, as I've said, generationally have been unconstitutionally funded. And so you're going to take the money that you could be investing into them, and you're going to siphon it away to private and religious schools. It's unacceptable. Our students deserve better across the Commonwealth. We need to invest in them now, and then down the road, a generation down the road. Let's see how this money, see the great things that are going to happen when we finally invest the way we should, and then that's the time to talk about it. But right now, scholarships are an absolute no for us.
Let's take a phone call from Barb. She's calling from Willow Grove. Go ahead, Barb.
Yes, my question is, what about the retirees? I have to pay school taxes. I haven't had anybody in the school system in over 20 years, and my Social Security only goes up if the government says, okay, the cost of living, it goes up, you get more money. When you keep your house down at 60 so you can afford to live in it, it's not fair to tell me I should pay more in taxes to the government, who doesn't care that money does not grow on trees. It comes out of my pocket, and when it comes out, that's less I have to. It's not a win-win-win for everybody when you raise this and that. And I went to Montgomery Community College, and I saw the kids. I got my degree in 2019. I saw the kids that I couldn't believe it when they asked, how I was getting A's. And here I'm 75. They were in their 20s. And they couldn't figure out how to do the homework. So you say, oh, we knew how to, we got to invest in more money. Well, I looked at those kids and said, where did the money go? Because it sure as heck didn't go to making them any smarter.
Aaron, you take that?
Absolutely. And unfortunately, we see this across the Commonwealth, where communities have to keep raising taxes because it's simple. The state has not invested in their school districts the way they were supposed to. And who's left holding the bag? It's our school districts. And those communities need to be providing an education that our students deserve. The state should have been stepping up, and they haven't. And now there is a solution, and the governor is starting to fix that in his proposal. But the fact of the matter is, generation after generation, we haven't been funding our schools the way they were supposed to, and that has an effect on the tax base across the state. So I've heard this story from the community that I've taught in, as well as around the Commonwealth. And if we invest in our schools, we're going to see a possible reduction.
Silas, we have a few minutes left on our program. I want to make sure we talk about nurses before we end our show. And can you talk about current staffing levels for nurses?
Yeah, and we have a staffing crisis in our healthcare system, just flat out. And to be honest with you, this is a crisis, a workforce crisis that existed before the pandemic, but the COVID-19 pandemic really exacerbated and exposed just how severe of a challenge we have in terms of keeping and having workers at the bedside in all of our care settings, particularly our hospitals and our nursing homes. And look, the staffing is about ensuring that every single person who's getting care has appropriate quality care and that they're getting the care that they deserve and that they need. And nobody should ever be in a hospital or nursing home and somehow suffer or live without dignity or potentially have worse health outcomes or die because they don't have a caregiver at the bedside when they need them. But that is happening every single day. Nurses have called for safe staffing ratios to be mandated in our hospitals. Those are evidence-based ratios that are agreed upon, agreed across industry that this is what's necessary in our hospitals to ensure that we have proper care. And you know, we had that move on a bipartisan basis out of the House last year. It's sitting in a Senate committee. Strongly call on the Senate to take action on that bill. And you know, in the nursing home sector, meanwhile, you know, the Wolf administration put into place staffing ratios for our nursing homes for the first time through regulation. And we hear that there are bad actors in the nursing home industry that are not only lobbying for more money, but actually lobbying to have staffing ratios rolled back and not only get more dollars, but try to escape accountability and ensure that those dollars go to provide care. We can't stand for that. We can't accept that. We're going to have caregivers at the bedside. They've got to be appropriately staffed. There's 60,000 nurses in Pennsylvania who are licensed right now who aren't practicing at the bedside. Because they are
Silas, excuse me. We only have about a minute left in our program. Is there any relief in sight for nurses in the current budget proposal?
The current budget proposal, as it stands, doesn't take any major strides that are going to address our staffing crisis. But there is plenty of proposals on the table that can get us there. And nurses and healthcare workers are calling with urgency for action on those proposals. Our
guests have been Aaron Chapin, President of the PA State Education Association, and Silas Russell, Executive Vice President of SEIU Healthcare Pennsylvania. Thank you both.
Thank you.
PCN's Ellen Franz talked to Senator Lynda Culver about after-school programs.
Welcome to our program. You are a supporter of Governor Shapiro's budget proposal for a Boost after-school program. What is the goal of this program?
So the goal of the Boost legislation, we've been working on it several terms. It's bipartisan. When I was in the House, we were working on it. And ironically, I guess, our Lieutenant Governor Austin Davis and I are both now over in the Senate. And he was a strong advocate when we were over in the House. So, you know, you have to take a few bites of the apple to get a piece of legislation where it needs to be. And, you know, there's concern. I've always been an advocate of early learning. And I had a constituent ask me one day, then what? And I asked, what do you mean, then what? What are you going to do after they get to school? I'm like, well, they're in school. I said, that's not the whole situation. Parents work before kids get to school. Parents work, you know, or, you know, long after kids are out of school. You need to figure this out. You can't put all that money into them early on and then not finish the job. So I thought it was a unique challenge. And when I talked to my colleagues, we realized that we do need a steady stream of funding for before and after school programs or out of school programs too, because, you know, there's holidays that sit in there. And, you know, I think it just does so many benefits. The first benefit of the Boost program is that children have a safe environment, a nurturing environment, a place where they can learn, a place where they can grow, a place where they can get some soft skills and socialization. The second piece of that is parents can go to work with peace of mind, not worrying, is my child home alone? Did a stranger come up to the door? Are they getting into trouble? Are they making bad choices? They are in a good, safe environment, which allows parents to work, which helps the economy of Pennsylvania. The third thing it does is it creates stability in these programs. I mean, right now they're applying for grants, they're applying, for scholarships, they're applying for monies all over, and it's all year that they're doing this. So when parents are trying to find placement, they aren't exactly sure how many kids that they can actually accept into the program. This gives them that comfort level of knowing, all right, this is how many slots we have, this is how many slots we can offer parents. That continuity of care is so important. So I just think this touches a lot of elements in our society that I think will be very helpful, and it'll keep children safe, and building on that foundation of, giving children the skills they need from 0 to 5 when their brain is developing the fastest. And we know when we invest dollars early and continue that on, it saves at the end. It saves, in crime, it saves in corrections, it saves in so many different things. So I always say, if we're not investing in the foundation, just as you would a house if you were building it, it could collapse in the future, or you could have problems. So part of that is, we've seen the benefits of these programs. We know they touch a lot of lives, and I know, there's differing opinions on how much money should be invested at this point. I think the House has $70 million in their bill. Last year we were trying to figure out what could we do it for, and we're thinking between that 40 and 70 million mark, but so grateful that the governor and lieutenant governor value this program. They see the importance of it, and they're willing to invest 10 million into it. And, it's a bite of the apple. We figure out, what works, what doesn't work, and we keep building upon it.
What is an example of some of these out-of-school programs? What do the kids do in them? Where are they located? Things like that.
So if I'm being honest, you want to be in one of those programs. They're great programs. It depends on where the program is. In my district, a lot of them are in the YMCA or run by the YMCA in the school building. If they're going to the YMCA, we just visited a program. They bring them in, they give them a snack, they run them. Whether they play basketball or sometimes they can offer swimming lessons. They've been in school all day. It's time to, get some of that energy off. And then they'll do homework with the students. So when the parent picks them up, the parent truly gets quality time with their child. They're not fighting and struggling with homework. A lot of that's already done until the child gets there. And their socialization. They have friends that they like to see. And sometimes they're from different schools. So they make, new friends and lasting friendships, I think, for these kids. And there's all kinds of programming that goes on for them as well, honoring certain days. Sometimes it's Dr. Seuss Day, sometimes it might be a nutrition day or pizza day or donut day. You never know what it is. But so they're teaching them all kinds of things culturally, and it's a really warm, positive program.
Would the funding for these out-of-school programs, would that carry over to summer camps or any other summer activities, or just during the school year?
That's a great question, and I'm not totally positive, so I don't want to answer that question incorrectly. It is for out-of-school programs, so it may actually carry over to the summer programs. I'd have to look at that again. I don't remember specifically seeing that in there, but it is for out-of-school programs, so it's a real possibility that it could.
Last question, how much support has these Boost programs and the initiatives you want to put towards them, how much support has that gotten from other members of the legislature?
So that's a good question too. There are a lot of folks that like it. A lot of folks that have kids, have grandkids, nieces and nephews in the programs and understand the value of them. Some people will say, why aren't the parents paying for the program? Well, the parents are paying for the program. This is just helping with the cost of the program. If we had parents pay for the cost of all these programs in their entirety, there would be a lot of children that would be missed going into these programs. So this is a way to ensure slots, ensure continuity, and make sure all kids have access to these programs, that they are in safe environments.
Senator Lynda Culver, thank you for your time.
Thank you so much.
Before we go, here's a reminder for you. On the Issues has Pete Shelley from Pennsylvanians Against Gaming Expansion on the subject of regulating skill game machines. He'll be here on Wednesday at 8 p.m. He'll be followed by Representative Lindsay Powell, who will tell us about her bill that addresses remote stalking. She's at 8:30 p.m. That's it for the PCN Capitol Preview. I'm Larry Casper. Thanks for watching.